Welcome to Cataract Lecture 2. This video will cover the signs, symptoms, diagnosis, prevention, and management of cataracts. Cataract signs and symptoms include painless, blurry vision, and reduced visual acuity. Patients may experience a myopic shift or a return of the ability to read without glasses. Other symptoms include astigmatism and visible opaqueness. Further symptoms include diplopia, abnormal color perception, and glare, which is often worse at night. Brunescence, a color shift from yellow to brown, reduced light transmission, and a yellowish, gray, or white pupil color are also signs. Cataracts typically develop in both eyes. Diagnostic findings for cataracts involve several measurements and tests. These include visual acuity measurements, the Snellen Visual Acuity Test, ophthalmoscopy, and a slit lamp microscopic examination. A blood test, visual field perimetry, and A-scan ultrasound may also be performed. Prevention strategies include avoiding risk factors like UV rays, X-rays, and smoking. Wearing sunglasses is recommended. Regular intake of antioxidants, such as vitamins A, C, and E, can protect against risks. Preventing accidents and properly treating underlying disorders are also important. Non-surgical treatments will not cure cataracts. Surgery is performed on an outpatient basis, usually taking less than an hour, with discharge in about 30 minutes. Topical and intraocular anesthesia, typically 1% lidocaine gel, is used. IV moderate sedation may be given to minimize anxiety while the patient can still communicate. When both eyes have cataracts, one eye is treated first, with the second eye managed several weeks later. This allows the first eye to heal properly and provides time to check the surgical procedure's effectiveness and monitor for any complications. Phacoemulsification is the most widely used cataract surgery. It involves a small incision in the eye's surface through which an ultrasound probe is inserted. Ultrasonic vibrations dissolve the clouded lens into tiny fragments, which are then suctioned out. An artificial lens is placed into the thin capsular bag. The steps of phacoemulsification begin with anesthesia and exposure of the eyeball using a lid speculum. This is followed by a minimal incision, viscoelastic injection for stabilization, and capsular hexis to emulsify and aspirate the fragments. Finally, the intraocular lens is implanted, viscoelastic removed, and the wound sealed. This image illustrates the process of phacoemulsification, showing the ultrasound probe in the eye, followed by the insertion of the lens implant after the cataract is removed. Extracapsular cataract extraction is used for very advanced cataracts, where the lens is too dense to dissolve. This technique requires a larger incision to remove the cataract in one piece. The posterior capsule remains intact, an artificial lens is placed, and an eye patch is needed after surgery. Intracapsular cataract extraction, or ICCE, requires an even larger wound than extracapsular surgery. In this procedure, the entire lens and surrounding capsule are removed. The intraocular lens is then placed in front of the iris. After the crystalline lens is removed, the patient is considered aphakic, or without a lens. Lens replacement options include aphakic eyeglasses, contact lenses, and IOL implants. An IOL is permanently placed, requires no maintenance, and is not felt by the patient. IOLs are typically made of silicone or acrylic material. Monofocal lenses are the most common implant. They have equal power across the lens and provide high-quality distance vision. However, they only focus sharply at one distance, and spectacles are usually needed for better overall quality. Toric lenses have more power in a specific region of the lens. Multifocal lenses are the latest advancement, with regions of different power, allowing individuals to see at various distances. However, multifocal lenses can cause more glare than monofocal or toric lenses. This chart summarizes the options for choosing a lens based on vision needs, including standard, multifocal, and toric intraocular lenses, and their ability to correct near, intermediate, distance, and astigmatism vision. Preoperative care includes an eye examination to confirm the cataract and suitability for surgery. Eyes should have normal pressure. If elevated, it must be controlled with medication. A combined cataract glaucoma procedure may be planned in some cases. Further preoperative preparation involves ensuring the pupil is adequately dilated and ruling out retinal detachment. Patients should be NPO for 6 to 8 hours in selected cases. Preoperative antibiotic and NSAIDs eye drops are administered, along with mydriatics and cycloplegics. Postoperative care typically includes discharge within a few hours. An eye patch is used, with the dressing removed the next day. The patient should be positioned on their back or the unoperated side. Eye protective shields are used for 2 to 3 weeks to prevent injury. Follow-up visits are scheduled. Patients are instructed to avoid touching the operative eye and prevent water or soap from entering it. They should avoid heavy lifting and exercise only in moderation. Other instructions include washing hands before administering drops, wearing sunglasses, and administering eye ointments last. Avoid smoking and driving.